Good morning mga katribu. Welcome to another episode of Business Sense. I am Komfie Manalo. Last month, we celebrated the World Encephalitis Day, and across the globe, there is a strong calling for greater recognition of encephalitis among both the public and in the healthcare settings, as well as increased trainings for healthcare professionals to devote or focus more on the risk and the threats of encephalitis. A new survey commissioned by the Encephalitis International, the global body for encephalitis, reveals that Filipino emergency medical professionals often overlook encephalitis, a life-threatening neurological condition characterized by brain inflammation, despite the presence of common symptoms. The survey results show that over half, or 54%, of local respondents did not consider infectious encephalitis, and three-quarters, or 74%, did not consider autoimmune encephalitis as a diagnosis when presented with a list of accepted symptoms of each condition. To tell us more about the threats of encephalitis, we are joined today by Ms. Roschelle Del Rosario, the head of data science and business insight at PPL Solutions. And she is also the mother of Alexander Del Rosario, a 23-year-old male diagnosed with anti-NMDAR autoimmune encephalitis. Good morning, Ms. Rochelle.
Good morning, Sir Comfy.
So I understand, Ms. Rochelle, that you are a mother of a encephalitis survivor. So how was
Yes.
can you tell us of your experience?
Okay. So my son is Xavier Del Rosario. He's actually 23 years old right now. Prior to his condition, he is a genetic engineer student at the
Mm-hmm.
University of the Philippines. So he is already in the college level. So during his initial symptoms on this condition, the presentation of his condition really is purely psychosis.
Mm-hmm.
So he's in a state of delirium, which can be easily mistaken as psychological problem. So initially, we went to psychologist to have him checked, and was diagnosed initially to be bipolar. So the challenge that we have there really is identifying it in the
Mm-hmm.
early setup, whether
Mm-hmm.
it's psychological or neurological. So we technically have a misdiagnosis
Mm-hmm.
in the early onset of his symptoms. He was given antipsychotic medicines initially because of the initial diagnosis of
Mm-hmm.
bipolarism, and that further aggravated his condition.
Yun nga,
His mental status was very difficult to address
yeah.
initially.
Yeah, was that very difficult because he was like you said, no, you he was no he she was diagnosed as a bipolar,
That's
but
correct.
his real illness was he had encephalitis.
The, yes,
So
correct.
and he was being given medication to treat bipolarism. So
That's correct.
and kailan siya? He was already 23 now, right? He's already 23. And when
He's
did
already.
these symptoms started showing? And when
So
did you
this is
discover that he has encephalitis and not the bipolarism?
yeah. Thank you for clarifying that, Sir Comfy, because the condition of my son really progressed very fast. So it took 1 or 2 days for us to observe him to have psychological breakdown, which again led us to meet a psychologist, not a neurologist.
Mhm.
And then after a few days, he had a grand mal seizure. This is a
Mhm.
convulsion. So because of that seizure, we went back to the hospital. Now in a emergency setup, ER, we went to the ER because of that seizure. And luckily enough, during that visit to the ER, we were told that there will be battery of tests to test whether or not really that condition is bipolarism or
Mhm.
neurological. So that seizure lasted for 5 to 10 minutes, but he had several seizures during the day. So the doctors then decided to admit him and do lumbar tap, CT scan, MRI, blood work, and so forth. That's the only time that the autoimmune encephalitis were being suspected.
Detected. Oh.
Yes, it's only a suspicion from the doctor side that he has brain inflammation.
Mm-hmm.
So, unfortunately, in the Philippines, some of these tests, most especially the viral panel and the cerebral spinal fluid exams, is not readily available in all hospitals. And in fact, we went to a private hospital, and that even posed a challenge to us because they don't have the laboratory to
Mm-hmm.
verify the condition of my son. So this was sent abroad, I believe so, in
Mm-hmm.
Singapore, to just validate whether or not this is really an encephalitis condition.
So you're saying that there's no local hospital, private or public, that has that facility to determine if a person has encephalitis or not?
There is one. There's a major hospital, private hospital, which is St. Luke's.
Mm-hmm.
However, we need to actually be in queue
Mm-hmm.
to have the results given to us. And again, we're just lucky that the doctor that we have, which is actually not a neurologist back then, but a infectious disease doctor,
Mm-hmm.
was very aggressive to push us to have submit this test to
Mm-hmm.
outside the country so that we could have our results. However, the results came in only 2 weeks after.
Mm-hmm.
So that means only after 2 weeks did we have the correct diagnosis,
So it
which
must,
is the
yeah,
autoimmune
it must have been very
encephalitis.
challenging for you. You know, you're treating your son. You're actually you're mistreating him, no, because of a
Yes,
misdiagnosis, and then
yes,
he was suspected of having encephalitis, medyo late stage na,
that's correct.
and then
So in
yung
I
testing pa wala pa rito. You have to go
correct.
to Singapore. So
Yes.
so how were how was it ano? How was it that the underlying factors that contribute to the challenge promptly recognizing ano yung kaimportansya ng kahalagahan na ma-identify yung encephalitis kagad-agad.
Yes. So as I mentioned a while ago, the aggressiveness of approach is critical to the patients with this condition, simply because in my son's case, he has a viral infection that led to the inflammation of the brain or to the encephalitis. So he has
Mhm.
HHV6, a viral infection that needs to be treated first with high grade antibiotics before the inflammation of the brain subsides. So, yun yung main challenge there. However, during that course of yung waiting time namin
Mhm.
to get the results in, he was already given antibiotics. However, those antibiotics are really uh, stopgap only. Parang band-aid lang siya for that temporary relief of, the symptoms that my son is actually experiencing. During that 2 weeks, he's purely psychotic, aggravated, and actually he was already intubated during that course of time. Simply because it was a fast progression during that time, and he have lost his ability to speak, to breathe, to eat, and he's not conscious anymore. In fact, after 2 weeks, on his third week, he was already brought to the ICU, and he had stayed there for 4.5
Mhm.
months.
Mhm. So ano yung ano, how does yung failing to correctly identify encephalitis affect the outcome for patients diagnosed with that condition?
So, as I mentioned a while ago, since the initial diagnosis was psychosis, the medicines that was initially given to him is antagonist to his
Mhm.
condition. This gave him and our whole family anxiety, and we're in a state of confusion ourselves on what to do or how to help him. We cannot believe that this can happen so suddenly.
Mhm.
So some of the precious time was taken out I mean, just getting the test results,
Mm-hmm.
right? And the correct medicines to him. Because we soon found out that after the viral panel test, he has HHV6 that we
Mm-hmm.
need to actually attend to first. And then that viral infection, the infusion of the antibiotics took him 21 days to complete. And these are high grade antibiotics, which, by the way, is also not readily available in the Philippines and
Mm-hmm.
not affordable too.
Okay. So, expensive pa yung mga gamot, ano?
Correct.
So, sa study na ginawa ng Encephalitis International, nasabi ni Dr. Ferron Ocampo that the lack of training in encephalitis recognition and management due to its rarity. Can you discuss to us the efforts needed to prioritize in order to effectively respond to patients diagnosed with encephalitis?
Sir Comfy, actually, it's a sad reality in the
Mm,
Philippines, no, that we have few neurologists
mm-hmm,
that are expert in this field because it's a rare condition in itself. In our own dialogue with our doctors, since this condition is considered to be rare, therefore only a few hours in the medical study or the medical education and training that this condition is being discussed to them
mm-hmm,
even. So this requires more specialty training and continuous medical education on the doctor's part. Um, and our doctors are admittedly, having to scourge literatures for autoimmune encephalitis. By the way, Sir Comfy, this is a multidisciplinary condition because it does not only affect the brain, it also affects the other body
mm-hmm,
parts of the patient. My son has a heart condition. He was perfectly healthy before encephalitis, but during the course of his condition in the hospital, he's being treated for his heart, kidney, liver, stomach, bladder. And this needs to
mm-hmm,
be treated alongside with multiple doctors so that the brain inflammation could be addressed as well. My son has multiple pneumonia, sepsis that he needs to battle during that course of time. My doctors even advise us that some of the treatment plan that he is being given are purely experimental.
mm-hmm,
So, unlike the other illnesses like cancer, for example,
mm-hmm,
that there's a treatment plan, autoimmune encephalitis doesn't have that treatment plan just yet. So, the protocols, the guidelines, the literature available to us are, not
and there's no
readily
model for
available.
that. There's no,
Correct,
yeah,
correct. We even reach out to Department of Health to do our own research. As you mentioned, my field of work really is in data science and
yeah, mm-hmm,
research. So it helped me really to extend that skill of mine to do research to help my son. We went to DOH, but unfortunately, DOH doesn't have autoimmune encephalitis. What they have though is Japanese encephalitis, which currently is the highlight of the studies or the research that they
so,
have,
wala tayong
but
data,
not
no?
yes, we don't have enough data for autoimmune diseases. In my son's experiences, NMDR, there are thousands of other autoimmune diseases.
Mm-hmm,
Anti-NMDAR is only one of those thousands.
mm-hmm,
So just imagine we're technically blind, and
mm-hmm,
even our doctors are blind. Add to that, add to that, the huge obstacle that we're really facing in our healthcare system, Sir Comfy, is the availability and affordability
mm-hmm,
of the first line and second line treatments of the medicines, because these are not covered by PhilHealth.
mm-hmm,
Unfortunately, these are all out of pocket, and these
mm-hmm.
are very costly. Even to let's say a middle income earning family, this is really a huge burden.
So as you've mentioned, based on your experience, there's no data available about autoimmune encephalitis, and our healthcare system is not really equipped to correctly identify the symptoms of encephalitis, and even our own Department of Health has no data on autoimmune encephalitis. The medicine, the treatment are all, most of them are, based on your experience, are experimental. So what do you think are the interventions that the government and the healthcare institutions should initiate to bridge the gap ng lack of data, lack of knowledge, and lack of information about encephalitis and lack of treatment? So what do you think should be the intervention from coming from the healthcare institution itself and the government through the Department of Health? But before you answer that question, we will be pausing for a short break.
And this break is brought to you by Angkas, Beat the Traffic, Bayad Center, hashtag Bigger Better Younger Bayad, and you can buy it all. Conti's Bake Shop and Restaurant, delightfully yours. Globe, atin ang mundo. Meralco, ang liwanag ng bukas. SM, we've got it all for you. Smart, live more today. Union Bank, it starts with you.
And we're back, and you're still watching Business Sense. Kanina, no, before we took a break, our guest, Ms. Roschelle, has discussed extensively her experience with her son regarding autoimmune encephalitis. And one glaring fact that we've learned so far is that the lack of data, the lack of information about autoimmune encephalitis in the there's no treatment plan available, because most of the treatment available are mostly experimental, and even there's in fact there's only one hospital in the Philippines who can diagnose or study the laboratory test for autoimmune encephalitis. So, and even her son was mistreated because he was misdiagnosed about his condition. So, with those challenges, Ms. Rochelle, what do you think should be the intervention coming from the healthcare institutions and the government through the Department of Health to bridge those gaps?
I think, Sir Comfy, what could help the Philippines in general really is the availability of the data. And how can we actually do that? In our own personal observation, most especially for the rural areas, because I'm living in the in Metro Manila, so it's easy for me to have access to both private and public hospitals. But just imagine in the rural areas wherein you know there are limited resources
Mhm.
from our healthcare agencies to do the survey for this condition. However, I also believe that the reason behind that really is because this condition has a high mortality rate. So patients that are diagnosed or could be diagnosed as having autoimmune encephalitis unfortunately die before they even get the proper diagnosis. They die first, right?
Mhm.
So it's so hard to get the families, submit and find out why these conditions are have
Mhm.
high morbidity rate. Um, so that's one. I think with the help of the public hospitals and private hospitals submitting this information to DOH, it will serve as an eye opener for everyone that we have this condition. While it is rare, while the condition is rare, there are a lot of patients that have this condition, but they don't have that, platform, for example, to really advocate for their patients or their loved ones. And it also this is Sir Comfy, this is the reason why I agreed to have this conversation, a dialogue with you to advocate not only for my son but and my family, but also for the thousands of Filipinos that has this condition but doesn't have access
Mhm.
to proper diagnosis and treatment in general. Our Department of Health doesn't have any appetite on
Mhm.
finding rare conditions. or rare diseases unless otherwise it's already an epidemic,
Mm-hmm.
right? Which is very sad. And that's the reason why I mentioned a while ago. We have Japanese encephalitis data, but the other encephalitis cases doesn't. We don't have it, and you will wonder why, right? Because there's really no interest from our Department of Health unless it's widespread.
Mm-hmm.
Also, some of the families that we've met during the course of our research, who become friends of ours as well, their complaints were, I don't know who to reach out to.
Mm-hmm.
Even my doctor is not aware of my son's
Mm-hmm.
condition or my daughter's condition. So who do we reach out? And when you go to Department of Health, you will be tasked of so many things, and you'll end up not having someone to really discuss your healthcare problem.
So how?
So that's the sad
Yeah.
reality of our
Mm-hmm.
country.
So how? By the way, before we proceed, how is your son now?
My son is on a recovery stage. Every patient with autoimmune encephalitis has a very long recovery stage. We were told and advised by our doctors that expect 1 to 2 years before he comes back to baseline.
Mm-hmm.
That's another thing, Sir Confi, because as I mentioned, the brain condition of my son needs to be treated by multi-dimensional
Mm-hmm.
doctors, that is comprised of neuropsychologists, and neurologists, and even infectious disease doctor.
Mm-hmm.
Unfortunately, these are not I mean, um, available in our setup. So, and also, he's already in the rehabilitation stage. Um, but again, that's another set of problem because we don't have an integrated rehabilitation network. You
Mm-hmm.
could get physical therapy as a separate one, but you will have to have another center for speech therapy and occupational therapy. We don't have an integrated rehabilitation center. Even the cognitive rehabilitation, we don't have that.
Mm-hmm.
So that's another challenge. But thanks for asking my son's condition. He's doing well. He's getting into the uh, correct progress as we are expecting, but it's very slow because
Mm-hmm.
the brain heals very slowly.
Like so listening for listening on your narrative, it seems that if you have a family member who has encephalitis, you will be on your own, no? So you, because there's no private and public facilities that can one that can properly diagnose the condition of the patient. Second, there's no integrated facilities to treat the patient, and there's no integrated facility then for the recovery. And then there's
Correct.
no data, there's no available information from both from the public and the private. So as a parent of a patient with encephalitis, what do you think are the efforts that family members should undertake to improve the patient care for those diagnosed with encephalitis? I mean, of course, you did it on your own. So, what's
That's a
your
deep breath for me.
yeah?
Yeah. Family support really. Sir Comfy, we were blessed to have a network of people, family members, and friends that really loves our son,
Mm,
which is Alex.
mm,
That network of support helps us really to drive through um, getting my son back to his baseline.
mm,
And when I say network of support, that is inclusive of obviously our doctors. Alex has 28 doctors today.
mm,
Um, Family members, friends, caregivers, nurses, and all of the family members that we have. I can't imagine, our situation being like this without that support. However, it will be helpful if our government is also part of that
mm,
network of support. As I mentioned, all of our expenses are out of our pocket. Some of the diagnosis and tests are not covered by PhilHealth. Our insurance, we've already maxed out our insurance, our personal insurances, our HMO, because the condition is so rare that it's not inclusive. Even again, if I were to compare it into a different country, which is probably high income generating country, um, most of these tests will be covered.
Mm-hmm.
Most of the medicines will be covered.
Mm-hmm.
And that's really it, Mr. Sir Coffee. To be quite honest, if the medicines are available, it's not affordable,
Yeah.
right?
Yeah.
And that's the challenge. We even have to, call our family friends in the US and in Singapore, in Hong Kong, to give us access to these medicines.
Mm-hmm.
However, getting accreditation to bring it in also takes time.
Mm-hmm.
So it's a waiting game for us whether or not it's available or not. My son has to have second line treatment, which is rituximab.
Mm-hmm.
Rituximab is a immunosuppressant medicine, which is technically so hard to find here in the Philippines because it's also being used to cure cancer patients.
Mm-hmm.
But again, it's so sought after
Mm-hmm.
that sometimes it's not available.
Actually, yan talaga ang pinakamalaking challenge sa ano sa Philippine healthcare eh. Hindi pa siya talaga nagma-mature yung healthcare system natin eh. But the you can only say that the country has a mature healthcare system if the patients are not paying uh, for their confinement or for their medication using their own pocket. It should be done through
Correct.
insurance na eh, di ba? HMOs or insurance. Eh sa atin hindi pa rin ganun
Right.
napakakaunti sa atin ng may HMOs and napakakonti lalo ng merong insurance coverage. So that's one of the
That's
things that
correct.
we should address din eh, yung sa ating healthcare system. So one final question na lang Miss Rochelle. So in the light of these complexities ng managing the encephalitis, what guidance would you offer your fellow parents who have family members who have encephalitis patients?
Sir Comfy, in the last 8 months that my son has this condition, I think our resiliency and faith and our hope to bring my son back to baseline help us a lot.
Mm-hmm.
If I were to advise a co-parent who has a loved one with the same condition, do not lose hope. Because sometimes, you will see the patient, most especially for my son, sometimes we thought that, hey, we're progressing in the right direction. One
Mm-hmm.
step forward, but two step backwards. That's how difficult this condition is. Um, However, being resilient on pursuing and get and advocating for your loved one helps, and also seeking support not only locally but internationally. And that's the reason why we encountered the Encephalitis International, simply because they're the only group that we've reached out to that gave us answers that are not readily available here. While the network of the Encephalitis International might be different in the setup, the condition of the patients are similar, regardless of age, their gender, their location. Their presentation is the same, which
Okay.
gives us a lot of idea of how to actually manage the condition of my son. So for my co-parents, or anyone who has loved ones who's having this condition, please stood by your loved ones, stood by your patients. Our faith and hope that they could be treated is there. While there is high mortality rate for this condition, there's also a huge part of being able to treat it, and have your loved ones, go back and have quality life after. That's our hope, Sir Comfy. We're only about 8 months, 9 months in our journey,
Mm-hmm.
in this disease. We still have a long way to go, but we're faithful that will help our son. And hopefully, in the future, Sir Comfy, he'll be able to sit down with me,
Yeah.
beside me, and able to share his
His
own
experience.
experience
Yeah,
with you.
yeah, thank you very much, Miss Rochelle. And you have our prayers and
Thank
for
you.
your son. And we are praying. We will be praying for his quick recovery. And hopefully, yeah, I'm sharing your dream that hopefully one of these days, your son will be sitting with you, beside you, and telling us his narrative, his journey, surviving this encephalitis, this disease. So there you have it, mga katribu. It all starts with it all starts with information. To properly diagnose a disease and to properly to give that disease a proper treatment, it all starts with information. It all starts with data. That's the main challenge that Miss Rochelle experienced. Uh, his son was diagnosed improperly because there was no data, there was no information available, and even the healthcare system in our country is not capable of properly identifying such a disease. And hopefully with people like Rochelle who's advocating for more information on encephalitis and Encephalitis International, we can educate the public more and hopefully get the support of the government to put more effort in identifying and properly addressing the threat and the risk of encephalitis. So mga katribu, thank you very much. This is Business Sense and I am Komfie Manalo.